Some patients ask me, Greg, how do you prevent scarring? And my answer is always the same: I can't. The reason I'm saying this is basically even as a baby in the mother's belly, we already scar. It's only in the first third of a mammal's development that we don't scar. So my job is not to prevent a scar, my job is to create an inconspicuous scar. And what are the ingredients for an inconspicuous scar? Well, first, decent hand-eye coordination of the surgeon, so meticulous closure. And something that is very, very important to create a good scar, that means that it's not stretched, it's not red, is avoiding any tension. Now, there are areas in our face that if it's done right, there is no tension. You can avoid any tension on the HeyHalo scar, on the facelift scar, on the nose job scar. It's a little bit different for a lip scar, because if you do a lip lift, this area is very, very mobile and soft. This is all soft tissue. So if you speak, kiss, smile, whatever you do after surgery, I tell my patients for 6 weeks you have to become a very lazy German upper lip, and you start speaking without engaging your top lip, which people might think you're arrogant or not interested, but it's actually to protect any kind of pull on the scar, because any pull is shearing forces stretch everything, increase irritation. Now, one thing that is absolutely normal, whenever you have a scar on your face, it does turn red. It's one of the phases of scarring, and it's called the inflammatory phase. And inflammation basically just means the body takes care of things in order to repair them. The redness depends on the area of the face. This area is quite red for a while, at least 3 to 4 months, and it's normal. As long as it's red, you have to be careful with sunlight. Sunlight can create a chronic inflammation which can darken the scar for much longer time. So SPF is critical. I tell my patients in the first couple of weeks after surgery, I want you to live a life of a vampire. Avoid direct sunlight on your scar. Be patient, listen to the instruction, and find a surgeon who knows what he does.